Yeah.
Awesome. Well, Angie, welcome to KCBC. I'm so glad to have you on the show today. For our listeners, just understanding, I've known you for what, 6 years now? We're
Yeah.
going on 5, 6 years, met in a previous healthcare role. So I'm so glad to have you on. I'm actually just super giddy because of all the folks that I've had on recently. You're a new guest. You're also bringing something new to this show. And correct me if I'm wrong, this is your first podcast,
Yeah, I was
correct?
gonna say I'm super honored because 'cause you're bringing something new to my life. I've never done this before. Shaking off
Yeah.
the nerves. I'm pretty excited to be here.
Yeah,
Thanks for having me.
absolutely. So I do think it's important for everybody to know about what you're doing with genuine growth. And obviously, we're going to have all your links in the show notes. But if there's anything else that you want to talk about today, just as far as what you offer clients and your experience, we're going to have time to get into that. Speaking of time, I got to make sure that I am tracking our time so I can be a good steward of it. But if you could just kind of start off with, your journey, I guess, into genuine growth, because I think it's really important for people to understand like what's motivated you to get to this point, and then also, of course, your experience will impact from there. But can you tell us a little bit about that?
Yeah, thanks. Well, I wanna start off with why what genuine growth is. It's, a coaching platform. It's my way of giving to people. I feel like it's a honor to be able to serve others through asking empowering questions and helping them find their value and get their authority back in their leadership. I am a nurse by background, 15 years in healthcare, and I just started getting this calling that there was something bigger out there for me. And genuine is a purposeful word that I use because it's one of my highest values is that I have to be me and to show up for me because this is the only life I have. And I want to be known as a genuine person. So I stepped into the brave step of stepping out of healthcare in June of this year, and it's just been transformative.
Yeah, absolutely. Can you kind of tell us a little bit about your experience in corporate healthcare? I mean, just I guess the discipline that you served in, just a bit about your experience and what you learned in that time. Because I mean, I think it's very invaluable. A lot of folks don't necessarily realize that when they're going to a coach, when the coach is telling them about all of their experience. Like, what is in that? Like, what has made you uniquely qualified to guide other folks through their journey?
It's so funny. You said uniquely qualified, and my imposter syndrome just like bumped up. It's like, bing, you hit the nail.
I've seen me do it. I know.
But what I can say is that, I was lucky to be able to lead multiple teams in healthcare. I didn't stick to one track. Ambulatory experience and perioperative or surgical experience. I worked on the floor, I worked in the ICU. I was able to see healthcare from a 360 lens. And it gave me this perspective that there are so many silos in our healthcare systems where the patients can get stuck. And through leading teams, my ultimate goal always was to create psychologically safe teams that could tell me when we're not doing the right thing, and to have spaces where those I was leading felt comfortable bringing ideas forward. And healthcare is a really hard job.
Big time.
At the very end of everything we do, there's a patient. So every action we take eventually touches somebody who's having the worst day of their life. And it causes this extreme amount of burnout, especially for leaders. And you're putting out fires every single day. There's a lot of pressure to perform and to do the right thing. I don't know how much the listeners will know that, like, there's a lot of KPIs in
Key
healthcare.
performance indicators. Those are metrics to judge you by how successful you or your team is. patient surveys. There's so many things that wrap up into that. There's a lot of KPIs. Yeah,
Yeah.
we've never talked about KPIs on the show, so yeah, that's
Wow.
the
Yeah,
first
yeah,
time.
great. I'm
Yeah,
glad we can talk about it. But
yeah,
those KPIs are very much served in metrics that can be measured, but nobody goes into healthcare to be measured. They go into it for their heart, and you can't measure the heart. And so I started noticing this trend that the things of the heart were getting left behind because you can't measure it.
yeah. Like, and when you say the things of the heart, what do you mean exactly?
Your why, your vision, your values, the taking time with each individual patient to see them as an individual patient, an individual person having a human experience. There's a lot of automation, and I'm sure we can talk about this later, especially as AI gets moving into all these areas. Automation automatically takes away the individuality of the person's experience and their personal health needs. And so there's this rift that becomes very apparent as you walk in the door and you're like, I got into healthcare to help people. And my job every day is to measure these metrics and to make sure that we're the safest place ever, right? We're taking care of the
Right.
patient best. Um,
Absolutely.
but it's really hard to remain human every single day.
Absolutely. And this is something too that I think I know you have deep experience with, and I want to tell everybody too that I personally in previous professional lives, I thought about this before our conversation today, and I said to myself, Michael, what is your healthcare experience? And mine was always on the operational end, right? So I've got very deep experience with HR and recruitment stuff in home health system, hospitals. We're talking California, even recruiting for other healthcare organizations remotely across the country. Also, then getting into the operational efficiency level of how to get people to start being problem solvers on the nursing unit.
That's how we met. Yeah,
That is exactly how we met,
yeah.
right? And that's why I always saw you too. Like you were one of those people like I always connected with like, I would shadow on, a unit that maybe you managed or that you had worked on. And I saw that level of care and intention that you and your team had. And that was where I think when I got out of recruiting and I was in the operational efficiency and doing lean things, that was where I really wanted to start to get to the heart of why people were doing what they're doing. And you're so right, like nobody signs up for healthcare like when they're in their BSN program, bachelor's of science in nursing, for those who don't know, or if they're trying to become a home health aide like in home health, or they want to be a hospice nurse, it is because they want to care for people. They are caregivers and they're willing to go through the educational, the credential, all of those hoops to make that happen. And this is something, to go back to my original point, this is something it is a US healthcare system issue. There is no shortage of Harvard Business Review articles,
You're right.
all sorts of other publications that are examining healthcare, caregiver burnout into where the system, it's like we're almost serving systems. The systems aren't really serving us. That's very popular right now, right? Not just in healthcare, but government, criminal justice, all that. We are starting to realize that we have to get back to our heart.
Yep, that's what I keep preaching is bring the heart back to healthcare.
Yeah, I noticed
Bring
that's
the
one of
heart
your
back to healthcare. We have to remember that the things that are unmeasurable.
absolutely.
And I think
Um,
that this has
yeah,
to be done through pardon me for interrupting. I think this has to be done by elevating our patient's voice and the patient's experience. You can go 15 steps and into any situation and say, what's your experience in healthcare? And person after person will tell you, I had to advocate for myself. I had to say louder and louder and louder, please listen to me. I don't feel right. There's a editorial that just came out in JAMA. It's by Dr. Barbash, his ICU physician, and he was recently a patient himself in the ICU. And he said, he basically, the point, I'm going to narrow it down. I'm not going to read it word for word, but he narrows it down and says, we have to bring the empathy back to healthcare, that the people know their bodies best. And that sometimes triggers providers, nurses, anyone, because they are like, I went to school. I have all this experience. I'm a scientist. I have a nursing degree, and I've been taught this framework. But when a patient says, I know you can't see it, but I feel off. I don't feel right. There's something wrong. There's story after story after story of patients who are then right
Right.
when it finally becomes visible enough to the eye that they're like, oh, you've been sick for a while.
Absolutely. So let me ask you about that, right? So what is one of I know there's a lot of different ways to tackle this, right? And that's what you do with genuine growth, but say I'm say I'm in, I'm in nursing leadership, or I'm in, I work for a nationally known company and I have, a few different clinics that I'm overseeing. Or I mean, gosh, if we just go down to the practice level, like I'm on the front lines, I'm a healthcare worker, right? Like what is your approach when somebody comes to you and basically expresses this need? Like what are the things that you will do with people, your clients, to help them kind of get back to that heart?
Yeah, it's a really great question. We talk about what our personal authority is. We talk about having an understanding of what our values are, because often burnout is not a failure of the person. It's a result of the system that they're in, and there's a friction, and it's gaining clarity on what that friction is and bringing it to light so that a person is able to make a choice. I call it the cost, clarity, and choice method, where we talk about what's the cost to me. I'm not sleeping. um, I'm stressed when I go to work. I'm making quick decisions that aren't necessarily what I want to make, but I'm making them based off of pressure from above or pressure from below. And then gaining clarity on that. Just sometimes saying that out loud, saying, oh gosh, I didn't realize that I'm really making decisions that don't align with my values. And then being able to make that choice and getting that authority back in your life, being able to pause before you send the email, pause before you walk into a meeting, gaining your sense of self again instead of just this pressure to perform. And
Right.
through that, through that is finding that you belong. You belong in that space. You There's a reason why you're there. And while not every person decides to stay in the job, they might say, you know what, this pressure of this job is too much for me, and they make the choice to leave. But it's based on an understanding of what they want to do and not necessarily off of a reaction that is based on fear and being out of their body.
Absolutely. Um, I really appreciate that. I could see how getting someone to understand their why again, get their agency, understand. I imagine too, there's some aspects there of like when people real, I know this from my own life, my own personal life, when I take responsibility for what I can control and I truly recognize what I can't control. Um, that makes me more effective in my role, like because I'm no longer focused on the things I can't control. So, Angie, on the flip side of that, when you're talking with a person that's working in the healthcare space and they have discovered through their conversations, through doing that deep reflection, getting back to their heart, that they want to stay and they want to find a way to influence or excel in their role in their capacity. What does that look like? Have you spoken with anybody yet that
Yeah.
you've helped sort of re-identify their why and stay? What does
Yeah.
that look like?
Yeah, I worked with a provider, a physician recently who came to me feeling like she wasn't really sure she was gonna be able to stay in healthcare any longer. The pressure of the patient loads daily were escalating, getting behind. The pressure to perform on the EMR was, like, more than the FaceTime that with the patients and just really
That's the
being just
electronic medical record, right?
yeah, I
Like
keep using
basically,
all the lingo.
no,
Yeah,
that's
sorry.
okay. Basically, for people, that is like the physician is spending their time documenting
Yeah,
and operating the system more than with the patient, right?
yeah, yeah, absolutely. And
Yeah,
so she was like, I'd like to explore what other opportunities are out there for me, how I could use what my passion is, but in a different field. However, by the end of our time together, about 3 months later, she was revived in her role. She was having what she described as more compassionate conversations with her patients. She was more present for those appointments. She felt like she was back in her body again. And she was reinvigorated with some research ideas that was bringing the passion back to why she was doing it. And it's just again about reconnecting to yourself. We tell ourselves a lot of stories, right?
yeah,
And those stories build up and compound, and then all of a sudden we're just overwhelmed. And sometimes it feels like the only answer is, I gotta get out of this situation. It's our fight or flight. But
right.
when we get back into our body and we connect with our why, then all of a sudden we realize, actually, I'm doing exactly what I need to be doing.
Absolutely. I know that going out on your own, starting a coaching firm is not for the faint of heart, right?
Yeah.
And you have a huge heart, right? You you've always had that, right? Like you have always been very enthusiastic about what you do. You have this ability to connect with patients and team members like instantaneously. I think you have this ability to build trust really quick. What has it been like being brave and going out and starting genuine growth? What are some things I want to like I want everybody to know. I mean, we've covered it on this show how it's a brutal journey and like how you get lots of advice and a lot of it's bad and you get some good advice and you figure out who the good coaches are, who good mentors are, good networking groups, all that. But I think more people, whether they decide to stay in full-time roles or they want to go out on their own, everybody should have something that they are able to build so that they're relevant outside of whatever organization they're in, right? And so many people are like, oh, I could never do that. Like I could never go on my own, or that's scary, or it's instability. And I don't know what else to call it. It's an employee mindset, right? Like it is this, I work, I give my time, they pay me money, and it's not perfect, but I do it and I do it every day, all this stuff. And they don't put value in their own experience. And I'm very obviously very passionate about this subject, but like
Yeah.
I just want to go back to like your journey. What has it been like? Because you started about 6, 7 months ago. Is that
Yeah.
accurate?
Yeah.
Yeah. So you're still in the thick of it, right?
I'm
You're
in
in the
the
beginning
baby
stages.
stages here. Let's be
Yeah.
honest. Yeah.
Yeah. So what has that been like for you? What are you know this about me? I ask 5 questions and pretend like I'm asking you one question, but what has your journey been like going out on your own like this and having these conversations outside of, you know, having that, you know, title, position, those other things, right?
Yeah, yeah, I think that there's a lot of I think to your point that the employee mindset is also about exactly what you said, title. It's having the
Mm,
title that creates an identity that feels like security to us. And so stepping out on my own, I really did have to say, well, what's my new title? And I had to take the coaching mindset, rediscover my values, understand why am I doing this? Was it brave? Well, like I say, there's a fine line between brave and maybe making a mistake, right? But the piece of it is that I just knew that in my role, I was not helping as many people as I really felt drawn to help. This draw to help more people needed me to step outside of a system
yeah.
and allow that energy to come to me. And have I woken up many mornings with like a deep, sharp breath of like, what did you just do? Yes. But have I met extraordinary people from all over the world now? And am starting to see that other people align with this crazy idea I have that the healthcare system has to be different. not always fun. I mean, I went to school to be a nurse. I'm a master's trained nurse, and nowhere in there did they teach me about business.
Yep. We're
So some
never
of it
taught about business, like,
no,
ever.
no.
Like,
I
yeah,
never thought of myself as an entrepreneur. I never thought I would be doing this. I never once woke up as a child and said, "I'm gonna own my own business." And so doing it has been the whole range of things, of scary to I wake up going, "I'm exactly where I'm supposed to be."
yeah,
Yeah.
yeah, I will say that a lot of that all of that actually that you just said, that all resonates with me, and when you're on a call or you're in a room or you're having a consult with somebody that you would have never had the opportunity to even meet, those are the times where it really reminds you, like, okay, I'm not alone. Not alone in this. And if I feel it deep in my soul, odds are there's several other people who are, whether they want to say it out loud or not. And I feel like there's more people who don't want to say it out loud than there are people who want to admit it. But by going out and starting something on your own and being burdened with, okay, Angie, like just playing, I know what devil's advocate sounds like. Okay, you think you can do it better? Make your own program.
Yeah.
You think you can do it better? Start coaching these people. And it feels insurmountable sometimes, but then there's moments where you go, no, I know what I need to do. I just don't know how to do it yet. Right. And so you get the help. You get help from people who are going to help you. You and I talked about that one book. I think it was like Coach Builder by Donald Miller, where he's like, write everything that you're good at on the left side of a piece of paper. And then on the right side of a piece of paper, how can you turn that into a product or a service or a way to help people, to help your people? And by doing that, those people are going to come. Like those people are going to find you. It's just they don't know who you are right now, right? There's people who have met you so far, and there's so many people that you're going to meet. And that is the uncomfortable piece of all of this, right? Is just that, okay, like I've got to do it. I don't have a $50 million a year marketing budget. How is marketing? I make things that I think are cool, but like, I've started trying to consult with others to say, what do you think about it? Because I don't know what I'm doing here, you
Yeah,
know?
yeah, that's exactly it. I'll make something, I'll canvas my friend, like, "You're
Yeah,
doing
me
stuff,"
too.
and then I'll send it to a couple people and be like, "Does this resonate? Like, does this
Yeah.
seem kooky?" But I'll tell you, I'm getting to the point, luckily, where, um, I just have to trust myself. And the questioning whether or not what I'm doing was part of the system that I just left. The constant questioning of whether I was doing because if I did it the way I wanted to, was it the way other people wanted me to do it? Was it in line with what they needed, what they wanted? I constantly questioned myself, and it was diluting my leadership. It was diluting my purpose, and it was holding me back. And I had to say, "No more." Like, I know who I am, and I know who I am right now, and I'm gonna know a little bit more tomorrow, and I'm gonna know a little bit more in a year, and everything that I go through is just a lesson on how of who I am and why I'm supposed to be here.
Yeah. Let's talk about that. The identity. Okay. That is so deep what you just said. That is a bar, that's a banger. Getting into your motivation for thinking things or doing certain things, and that I've started calling it like the decoupling process, like because I my experience is like a train wreck. Like here at this place 2 years, here at that place 5 years, this place 2 years, 1 year, and on a resume, it looks like a person who can't make up their mind, but I have a story. I have a deep story for every single one of those moves. And I had to tell people when I got laid off in 2023, like it was not due to performance because people who've been employed for the last 20 years and have never had to go through a layoff, they assume every reduction in force is like about getting rid of your lowest talent or whatever. But there's all these lies. That's where I'm going with this, right? Like there's these things that we believe, and if we do that long enough, we start to believe it about ourselves. And then we're like trapped in this sort of like feedback loop of like, what of my identity is actually even what I am, instead of, a combination or conglomeration of multiple different identities, because I was trying to fall in line in previous roles, right? There's a for me, it goes I go to anger too. When I realize those, like, I feel deep anger for myself. Like, how could I ever let myself get that far away from my why? You know?
And it's about raising the energy out of that anger up into the lesson that we're supposed to learn from that. And when we are able to step out of the anger and step for me, it's victimhood. I go into the like, oh, woe is me, and I can't do better. And like, I screwed up again. Why would they ever trust me? But when I can step out of that, I learn the lesson out of it. And I'm able to help others find their lesson and say, well, what was it that you were really supposed to be learning from it? Those lies that we tell ourselves, our brain's just trying to protect us from some sort of pain. It's trying to protect us. Some people call them gremlins, and we call them imposter syndrome. We call them all these things, but like it's really just our brain trying to protect us from the hurt and from the anger and from maybe a failure. And when we can step out of those energies up into learning from it and helping others learn from it is where we find our true power.
Absolutely. What are as you're I'm very curious because you've got such deep insight, and from your lived experience and your decision to go out and help others, what are you most excited about, in the coming months or just for this year? What does that look like for genuine growth? It's so important for us that we know, like, especially we're in the beginning of the year, we're not in January anymore, but to have goals and what we want to accomplish. And so what are the things that you're most excited about for the business? And you've got a Substack too. You've been writing more. It's awesome to read your reflections. And
Thanks.
yeah,
Yeah. Well, I am hosting a webinar on February 19th for it's a brave leaders finding your authority in a difficult system, and really geared for your healthcare leaders, but it's for any leader who wakes up going, why am I doing this? Why am I in this system? And we're going to talk about those three things that I talked about: cost, and clarity, and then choice. And then we're going to talk about our pause methods to help you make just brave decisions when you go to work. Um, and then I'm also going to start the Brave Leadership Culture Lab, which is a 4-week series that I'll discuss more in that webinar, to create a small lab, 10 to 15 people only, that can come and have a safe space to talk about some of those difficult choices that we have to make and how to get our authority back with real life situations and real life coaching. And I'm still continuing to do one-on-one coaching throughout the year, um, and my ultimate goal this year is to write a book.
that is awesome. I love how you've started that lab as well. You call it, what did you call it?
The
Culture
Brave
Lab?
Leader Culture Lab.
Brave
Yeah.
Leader Culture Lab. That is awesome. What I mean, just very curious, what does a brave leader look like in healthcare?
A brave leader is a person who understands their why and measures that alongside, not outside of the needs of the system that they're working in, and makes comprehensive decisions about how they're going to lead their team from wholeness and not from fear of being fired and not fear from looking silly for saying things that are outside of the box, but really being able to lead from their true understanding of who they are.
Absolutely. I know that you and I have had a lot of brave leaders in our professional life. And I think when I've worked for brave leaders, because I've had a mixture, I've worked for brave leaders. I've worked for leaders that were, working on themselves. And thankfully, I've just had a handful of toxic leaders. I can probably name them on three of my fingers, two fingers. And even then, I've realized that I think they were trying to do their best in certain situations, and it was probably a product of burnout or some other factor outside of the work. I've
Fear.
learned in
Yeah,
my go ahead. Sorry.
fear is probably a lot of, like,
Yes.
yeah,
Oh yeah. Yeah. Some people, the way they respond to fear is they just get nasty, right? Or
control. Yeah,
control. Yeah, it's about control. But I was part of this leadership cohort recently, and something I realized was a lot of folks in the class, myself included, we have these moments where we like to dogpile on what bad leadership looks like, right? And we really need to talk more about what good looks like. And I think, like, I've I've shared this on episodes too. Like, if you define yourself by what you don't do or the habits you don't have, the question should be, what are the good things that you're doing? What are the good habits? Define yourself by what you're doing and how you're showing up and how you're challenging yourself. And this idea of, leadership is absolutely bravery, it's so true, because when you become a leader, your success isn't necessarily based on your individual products you're producing anymore. It's the
yeah,
success of your people. And I think that's another component too, Angie. I mean, maybe you agree, I don't know, but I think a lot of people, they don't know what they're signing up for when
yeah.
they become a leader. And there are so many people, and no industry is exempt from this, but like there are people that are just promoted to be managers, directors, because they're really good at the job that they had before they became a manager.
100%. And they're really good at networking. I'm gonna just be honest,
Yeah.
but it doesn't necessarily make for a person who's going to inspire others, that's going to recognize the humanness in your team, the individual needs of the team members. There's so many things that go into play when you're a leader. You know, we're all humans having a human experience, and the system is always going to try to push for compliance. We want it to flow like water, right? With there being no hiccups. But bravery in leadership is leading with integrity. And that sometimes doesn't always equate to compliance. It equates to saying the system isn't working the way it needs to. And that's evidenced by our team turnover, our patient reports, our ability to do our job is being impaired. And sometimes leaders will choose just going along with the motions and saying yes to policies, procedures, and actions that don't actually help the patients at the very end. I'm speaking from the healthcare perspective there, but you can translate that into manufacturing. You can translate that to any corporate setting. Their end product should be the key that we should be listening to. The front lines should be the ones that you're listening to find out the health of your company.
Absolutely. Yeah, I let me ask you this, the front lines, right? The frontline folks are who you should be engaging with, right? And they're the closest to the patient. How do you get through all the layers that are in healthcare, right? The layers where we've talked about this before, right? Like in the lean training, I remember, I'll never forget, one of the things that made me fall in love with that. That's why I still tell people about my certification and why I love doing it, is like the idea with that approach. And there's a few different other approaches like it, but it's like that decisions would not be made from, the tower, right? That there would be a connection with the people that they're serving. And so often, I think layers in every industry, they happen because things get so big, and so you have to have layers of leadership and all that. How do you break through those leaders? How can healthcare executives, for example, break through those layers that maybe don't put them in touch with the patients or the frontline people?
Well, I think you have to build that system into everything you do before You go to the people, and we talk about that in Lean all the time, respect for the people. You have to go to where the work is being done, and if
Right.
someone says they don't have time, they don't have the space, they're too busy making the decisions to be able to go where the work is being done, I'm gonna challenge that to say, "Well, then where do your values lie? Where do your values and the decisions that you're making lie? Do they lie in the boardroom? Is it just in those KPI metrics? Or does the value that you see in the work that you're doing lie where the patient actually is or where the work is actually
Right.
being done? Do you care
Yeah,
about the
that
end product or do you just care about the metric?
absolutely. Yeah, I think and what I'm gathering is that I think when folks are meeting with you, it seems that it's a sort of wake up call, right? Would you
Often.
say that?
I
Like
think you bring to
often?
it what you want, right? I mean,
Right.
there are let's just be really clear, there are people that the coaching, it's not right for them yet because they're not really ready to, like, look at themselves and to have accountability. They're still playing the blame game, they're still pointing the finger at others, they're still living in anger and victimization, and "It's being done to me," and such, but those who are ready to step into what this life is for them, those are the people who see the most efficacy and the most change with coaching.
That is a great point. I've met with people, I've had coffee with folks to talk to them about their business, what they do, what their pain points are, and I've told them about what I can do. And I tell everybody, if I can't help you, I probably know someone who can. All of the coffee consults or whatever, right, coffee connections that I've had that haven't worked out, I do believe, I think, because I did a lot of deep reflection. A lot of those did not work out because they were not ready to have somebody get all their ugly out of the closet.
Mhm.
And it
Yep.
wasn't even their ugly. It's like if you have a company or you've got problems, they just weren't ready to show that to not just me. I don't know. It might have been a me thing. They might have said, no, no, he's just not the consultant for me. But I don't know that they were ready to do that. And you absolutely have to admit that you've got some things that need to be addressed. And if you knew how to fix them, they would have been fixed.
Yeah, I mean, our society is built on being shamed for the things that we see as weaknesses. Like, that's the society. We've all grown up with being ashamed because of something that kids made fun of us for, and we've, like, hidden it and tampered it down and tried to hide it away. But being honest that a leader is not expected to know everything. That is not the definition of a leader. A leader is a person who seeks out the information, who seeks out the people who do have the answers, who brings those answers up to light, but not somebody and you're not expected to be perfect. And I think that's a fallacy in certain meetings and boardrooms is the person who's the most put together, the posture is perfect, the outfits, they got it going on, right? And somehow we've decided that's the person who's really in charge, but that doesn't like always equate to the right end product.
Right.
The person who speaks the
Absolutely.
loudest isn't necessarily the one who has all the answers.
Yeah. I know that's been well studied too as introverts, extroverts. I consider myself an ambivert in leadership. People assume I'm an extrovert, but like this idea that we can learn so much from the quiet strength of the leaders who, aren't going to get up on a stage or have a microphone or do a TED talk, but my goodness, are they absolutely crushing it in their role
Yeah.
with their people that they serve or maybe, we've had the honor of working with a lot of amazing, strong, selfless, caring people in our life in healthcare. And there are just those people that it's like they are exactly where they need to be at this point in their life. They are just obviously they're doing it And whenever you start to add some of these other factors or there's that pressure or that shame, it's it's not a surprise to me anymore. All those things, the why, the empathy, fatigue, all that stuff kicks in. And we I don't know that and yeah, none of us can escape fight or flight mechanism. And I've been in situations where I was in fight or flight for months at a time. And the effect that that has on your sleep and your family. I've said it many times, like, if I'm not feeling happy with what I'm doing with most of my time away from home, I come home, that makes me a irritable father, not a great husband, like all those things. And I've often had to get back to that to find that strength. And I truly want that for everybody. But at the same time, like what you're saying is you have to have that, is it the humility or that recognition that you need help, you know? You
Yeah,
need to
when
ask for it.
I've asked this question to quite a few people. I feel like I'm gonna do a sociologic research study on this, but asking for help seems to be one of the hardest things that people have to do. And even just admitting that they need help. That's like the key underneath it. They're like, I don't need help. I'm just crunching along. I'm just pushing and pushing and pushing because I got this. I don't want a partner, or I want the credit, or there's this sense of ego that happens. And when it's almost seen in corporate life that you finally have to crumble before you ask for help, before you
Mm,
admit you need help. And by that point, how many people have you laid to waste behind you as you've trudged along and you haven't asked for that help or even admitted that it's not going well? It's going great. I'm doing great. Everything's great. And behind you is just wasted time and energy and pain and possibly disconnecting from your team, disconnecting from your why. Everything behind you is evidence that it's not working.
absolutely. Yeah, it's sad but true that often I don't wanna say too late, because it's never too late to admit, but that there has been damage. And I think that's what I've had to recognize in myself too in situations. I've called former coworkers and I've called folks who reported to me like 18 years ago because one day I was sitting there and I was going, gosh, I could have done better and I didn't. I chose myself in that moment. I didn't I didn't choose the well-being of that person or whatever. And what happens most of the time, and maybe this is a good thing, is they've said, I've totally forgot about that. You know, I didn't even recognize that, but like people are paying attention, you know.
Yeah.
I I wanted to ask you too about what it has been like expressing yourself through genuine growth, through the Substack. Now you're on a podcast, right? And that's amazing. But what are some things that I guess challenges that you've had, and then maybe some of the breakthroughs that you've had by doing this work of making your business, getting yourself out there, getting your thought leadership established. What has that been like for you?
I'm gonna come from a real vulnerable place and say this, that some of the things that I write about when I'm challenging some of the system thoughts around healthcare and some of the things that I say here today, you know, make me nervous because I have grown up in a corporate mindset of compliance and I'm saying things that are challenging it. And I'm doing the exact thing that I'm asking other brave leaders to do that are working in the system. And I feel that tension and how hard it is because some of the things that I write about just aren't said, but they need to be. And when I write, sometimes I hit that post and I'm like, oh dear, I can feel the people that I used to work with. I can feel the people that are out there working in the front lines saying, okay, I'm just trying to do the best that I can. And I want anybody who has read that and felt that and is listening to me now know that I'm not pointing my finger at you. This is a system that was created before you. You are a product of that system and you're working inside the system. And I don't think anybody is doing it with the intention to hurt
No.
or silence others. But there is a system of silencing in healthcare. There is a system that is broken that is not helping patients. And if that's all I get out is just uncovering it and speaking the truth, even if I'm the person they're like, "Ah, she's a quack. Like, don't listen to her. She just gets on her soapbox. Her mom said she was born with a soapbox in her diaper." Like, I've had a soapbox since I was born. I just throw it
I've never
out
heard
there.
that one before. That's amazing.
Yeah, thanks, mom. But if that's all that this is for me, like, I just feel like I have to and I have to say those things that are said in closets and behind closed doors, and nobody feels comfortable voicing it. And as I said earlier, every time I put it out there and someone private messages me and says, "Thank you for saying that," I'm like, "Okay, okay." Like, that's and I'm gonna tell you that a lot of my readers are the quiet ones. They're not necessarily commenting because they're afraid of what their job will see it and that they'll be questioned about it. They're not posting about those things because we've been taught to not comment publicly. We have to be the face of our company.
Yeah. Which, by the way, hot take, our companies do not pay us for.
Right.
They don't pay us to have our LinkedIn profile. And this is something in my current company, it's well known. And I basically said it in my interview. I said, I will never not have something for myself ever again. My commitment to you as my employer is what I do in my business, my podcast, it will never interfere with work hours. And I am going to create a new LinkedIn profile just for all of my activities here
Mhm.
so that I don't have you guys wondering about my color scheme on my profile, my headline for my personal business. I don't want any of that to fight. So I made a LinkedIn profile just for my current company, and it's great. Actually, it's doing so much better than my other personal profile for my business and my podcast because it's a completely different industry, and that's something that you know I'm very passionate about that, how I get it. And I do understand these policies need to be in place, right? Like you definitely have to understand that when you're on a social network and you are using the title and the credentials and the position that that company has endorsed and paid you for, there is an unspoken contract. It's like, okay, yeah, whatever I post here, like we saw this with like the sharing of political posts, like LinkedIn, like six,
Yeah.
7, 10 years ago. It's not just an all business platform anymore for those that did get the memo, but people have to understand, right? Yeah, like if you do that, but also like, you know, the LinkedIn thing, the all the stuff that we do online, it's like we have to be people at the end of the day. That's why people have private Facebook profiles and some people refuse to connect with any coworkers on Facebook because it's friends and family only. We have to keep these safe spaces. And I will tell you, Angie, I'll tell you right now, I promise you more people are paying attention than you think because people I've gotten I've gotten private messages about things that I posted and I was like, ugh. And I've received like 6 paragraphs, seriously, literally from a dude that was like, I am so glad that you posted this. I needed this. I've been dealing with imposter syndrome, all this stuff. And I was like, he was the guy I did that for. I didn't know. And that post got no likes. It got no engagement. It got no response. And more people are paying attention than you realize, always at all times. I'm saying that to you. I'm saying that to me. My wife is upstairs. She's got her own platform she's building.
Yeah.
Like people just, not everybody thinks to just show their appreciation by tapping that little thumbs up, but
Yeah.
they're watching, they're paying
Yeah.
attention. And when you do it, it's like when you go out there, you be bold. I love how you said, I started this so that I can prove to my possible client, my clients, my future clients that I'm doing what but I'm asking them to do,
Yeah.
living that example, you
Yeah.
know?
And it's really hard. The thing is that we cannot continue to lead from emptiness. And I'm asking people to lead from their wholeness. And wholeness includes vulnerability and being honest that you're a human being. You make mistakes, you don't have all of the ideas, you don't have all the answers. Like, leading from wholeness has got to be the thing that inspires. And my hope is whatever seed that I'm laying right now is that eventually healthcare will be about humanity and it will be about seeing health everywhere we go. That's what I health care is in my mind. And do I have all the answers of how that's gonna get there? Absolutely not. And that's why I'm trying to get brave leaders to come into these small groups so their ideas can flourish and we can grow this thing from the inside and say, like, we deserve better, our patients deserve better, our staff deserves better. We've got to bring the heart back to healthcare. I'm gonna say it over and over and over again.
I that's beautiful. I had one thing I wanted to say, and then I'll leave it to you to close us out today. Okay. I've been getting this vision as I've seen you go on this journey with genuine growth. And as you talk, and it just hit me like full circle just now when you said, like, I want to be very clear. I don't know all the answers. I don't have all the answers. That's why I want to bring other brave leaders into this community so that we can, then start to see that change happen. And I think what you're doing, I think it's huge. It is well beyond needed. It was needed yesterday. It was needed 20 years ago, something like this. Have you found others in the space that are doing something similar to you? Have you connected with people from other states? Are there other folks that are going out or joining you on mission in this?
Yeah. Yeah, I am I able to shout out other people in this space?
Absolutely.
Yeah.
Absolutely.
So Sarah Dash with Dash Collectives, she is a healthcare policy advisor in DC, and she's worked the advising side of this, and she's working the same. She's has the exact same vision, and we were so lucky to be in a space together where I heard her like say like healthcare policy leaders can't speak out and they can't speak up and bring forth new ideas, and I was like, whoa, we've got to meet. She is exceptionally intelligent on the policy side, and she too says, I don't have all the answers, I'm not rebuilding all of the policy, but we should have a space where policy advisors can come together. We are talking about building a podcast where we bring patients and leaders and advisors all together, where we can get all these voices together and allow others to know that they're not the only ones with a kooky idea out there, that things need to be different. You're not alone. That's going to be my last thing I say. These leaders, you out there who you think that I just have to walk in the door every day and put a smile on my face to make sure that I have a paycheck coming in, but you know your heart is pulled to do something different and you want to see it be better and be different. You're not alone. I thought I was alone. That's what led me for years to feel burned out, was that I was like, "Oh my gosh, I'm the only one. I'm crazy," but you're not alone. I'm here. Get a hold of me. Talk. Have coffee.
Absolutely love it, Angie. It has been awesome having you on the show. I think we're gonna have to do it again. Maybe we'll check in again later
Yeah.
this year. We'll have you on KCBC. Wishing you all the success with the call and the laboratories.
Yeah, the webinar is on February 19th. It's a free webinar, 2 hours at 11 o'clock Central Time. The link is on Instagram, and on LinkedIn.
Okay, that's awesome. And we'll get this out here. I'm gonna get this episode out today. everybody, as you listen to Angie's story, I ask you, I implore you, send it to your friends. I know a lot of you know me from my healthcare days. You listeners, y'all check in on me. You check the Instagram stories. I see you and I appreciate you. I love you all. Angie, it's been so awesome. Did you have any final words for us, or how'd you want to close this out today?
Hey, I want to thank you. This has been such an empowering and safe space to talk about some things that are hard, and you've made it an absolute joy. Loved every minute. I can't wait to connect again.
Awesome. Sounds great, Angie. Thank you so much.